I am Elizabeth Shepard, and this is my reflection video. Teamwork in healthcare is critical for the delivery of high-quality, patient-focused care. It empowers professionals from various professions to work together, share resources, and coordinate activities that strive towards holistic resolution of complicated health issues. Bulljack 2022. Adequate cooperation promotes cross-disciplinary discussions, simplifies treatment processes, and improves patient outcomes and safety in general. Healthcare delivery efficiency is increased through reduced source waste, reduced potential for mistakes, and skillful teamwork. Thanks to the collaboration that promotes teamwork and mutual respect among the healthcare team, consequently, it facilitates correct healthcare of patients who benefit from holistic, coordinated care tailored to their specific needs and expectations, therefore contributing to better health outcomes and greater well-being. In the scenario that I envision, I participated in a health professional team that included doctors, nurses, social workers, and pharmacists who strove to improve patient outcomes. For patients with chronic conditions, our main aim was to improve the coordination of care, ensure the safety of medication administration, and expand the reach of patient education program to limit the number of hospital readmissions and ultimately improve the overall level of health in the patients. Learning from interdisciplinary collaboration experience demonstrates how great success can be achieved where improvement is needed to attain anticipated outcomes. For instance, interpersonal communication and mutual understanding amongst team members made exchanging ideas possible, which were crucial in solving problems and improving patients' care. Quam and Paducah, 2021. Furthermore, holding more excellent quality patients as a common goal provided a sense of unity that pushed the team to work together and prioritize the collective success of healthcare systems. Nevertheless, although this collaboration had many good sides, some particular components could have been improved so that the results would have been even better. Role ambiguity and overlapping duties sometimes result in the misunderstanding and insufficiencies of work execution. Albalade and Abraganza, 2022. Moreover, the absence of regular formal feedback and reviewing options made it more difficult for the team to diagnose and treat the problems in advance. By addressing the areas for improvement, the following collaboration opportunities will be taking the strengths and avoiding potential pitfalls to success. Inefficient management of resources. The lack of cooperation within multidisciplinary teams affects the inefficient staff and financial management and puts patient care and organizational outcomes at risk, according to Kolesko et al. 2021. Poor teamwork may lead to rising healthcare costs, dropping levels of patient satisfaction, and higher rates of medical errors. Team members must communicate efficiently to avoid repeated unnecessary tasks, wasting time and resources, and incurring additional costs or delays. Such conflicts can be caused by miscommunication, leaving issues unresolved, which may also result in workflow distribution and might even lower productivity, causing more inefficiencies in the use of resources. The negative influence of inadequate and interdisciplinary collaboration is traced not only through the human resources team, but is also felt by the organization at large. On the other hand, human resources will become subject to higher stress levels and burnout if the collaboration has no effect. Personnel realizing their tasks are unclear or roles duplicated may cause an emotional state of overstress and underuse, leading to reduced morale and low job satisfaction rates. Origami Biz 2022. Additionally, conflicts over lack of communication or unresolved issues may further erode interpersonal relationships and build up a tense working environment where all the players cannot collaborate and are not productive. As a result, skill shortages in the professional team are heightened, with high turnover in recruitment and retention difficulties, which can worsen the pinch of resources. The financial impact of insignificant interdisciplinary collaboration is equally remarkable. Inefficiency in resource allocation and wastage caused by replicated action or mistakes can consume many expenditures for the organization. Auritzi 2023. These, for instance, may include tests and procedures conducted to resolve a miscommunication or coordination issue between medical personnel due to increased costs and healthcare expenditure. Additionally, substandard patient outcomes due to ineffective collaborations can likely lead to charging patients within a given time and complications to prevent healthcare systems from controlling affordable costs. Consequently, the time and resources allocated to resolving errors or dealing with conflicts between the same team divert resources from other crucial initiatives, reducing the organization's flexibility and inability to adapt changing healthcare needs. Consequently, the failure of good interdisciplinary collaboration is not just a human resource issue, but also poses as a major financial problem. Best practice leadership strategies. Implementing transformal leadership as proposed by Bass, 1985, is the most effective strategic direction for promoting team harmonization and effective interactions among interdisciplinary team members. Me et al. 2022. Transformational leaders set the stage for positive change by piecing the vision together, providing targeted support to every team member, and creating a culture of innovation and performance support. Through the creation of a shared vision, encouraging teamwork, and making sure each individual feels personally relevant to achieving the team's goal, as well as letting them bring their perspectives and skills to the organization, transformational leaders bring people together and in this way coordinate the group effort into collective success. A study by Albacore in 2022 demonstrates transformational leadership as an influential factor enhancing team performance and innovation in healthcare settings, enabling interdisciplinary collaboration and organizational achievement. As a leadership practice, servant leadership can also benefit from the team's ability to achieve its objectives. Conversy and Menilal 2021. The central tenet of servant leadership leads to putting others above and being more of someone who facilitates the work process instead of acting as a controller. By constantly dealing with concerns and giving mentorship alongside creating an enabling atmosphere, servant leaders become a safe harbor where people can feel confident and collaborate. It aligns with the principles of patient-centered care and promotes a culture of empathy and compassion within the team. In addition, a study by Cavanzi and Minalelli 2021 suggests that servant leadership strengthens the interpersonal relationships among healthcare professionals and their satisfaction, resulting in better patient results and organizational performance. Servant leadership as such can motivate interdisciplinary teams to overcome impediments in their way and accomplish their task effectively. Best practice interdisciplinary collaboration strategies. One of the best strategies for collaboration in team-based care delivery, as Will 2019 suggests, several team members with specialist knowledge from various disciplines use the multidisciplinary care approach to determine a WALI integrated treatment plan by creating an atmosphere where collective respect and trust are standard for the team. They stand a better chance to exploit the different talents and opinions of the team members, leading to better problem solving. A study by Zagariah 2019 reaffirms the advantages of teamwork and how it improves patient outcomes in healthcare delivery systems. Another successful way of building bridges between departments is introducing a robust communication system with the proper protocols. A practical communication approach is vital because through it one can share information, coordinate different activities for caregiving, and reconcile problems promptly. Shannon 2021. Organizations may achieve smooth collaboration among teams by holding regular team meetings, sharing healthcare records automatically, and actively supporting patient discussions among team members. It gives a high chance of improving care outcomes. In addition, healthcare professionals could embrace a shared partnership that can uphold interdisciplinary cohesion and boost the team member's sense of commitment. Through participation in the decision-making of all stakeholder processes, all team members can switch to wisdom and expertise of create participant-oriented healthcare plans that meet individual preferences and needs. Allerson 2022. This strategy facilitates a culture of empowerment and inclusiveness, in which all team members understand that they are cared for and appreciated. According to Montreal 2022, shared decision-making is associated with patient satisfaction and treatment compliance, thus ensuring the improvement of interdisciplinary collaboration and achieving goals at the organizational level. In conclusion, a successful interdisciplinary teamwork model is an indispensable component of the healthcare system to meet patients' needs and improve the organization's performance. By enforcing best leadership practices such as transformational and servant leadership and severe implementation of interdisciplinary strategies, such as team care and clear communication plans, teams would tackle challenges, successfully work as a team. Healthcare delivery is made more efficient because of teamwork by accepting the basic principles of patient-centered care and mutual respect for diverse perspectives. Through this, the management of complex healthcare system, utilization of resources, and improving care are made.